Good morning, everybody. Can you hear me? Okay. Can you hear me? Mic on? It's a bit soft. Should I stand close? Kan je horen? The sound is a bit soft, I think. Can we turn it up somehow? I have another mic, so I could try. Better? Is this better? Yeah, I think you have to stand like this, guys. Okay. Good afternoon, everybody. Thank you for joining this very important session on migrants who use drugs. I'm starting now because we have only an hour and we have lots of interesting stuff to say, so please have a seat. If you can't hear us because we have to stand like in the microphone and it's difficult to keep doing that, so just flag like we can't hear you anymore. My name is Busz. I am from Mainline Foundation in the Netherlands. I hear a lot of background noise, but I'm just going to talk anyway. I think people are having coffee still. Katrin is interfering. Okay, hey, this is much better. Whoa, hey. All right, I'm just going to start over. Everyone can hear me now. Good afternoon, everyone. Thank you for joining us in this very important session on migrants who use drugs. My name is Busz. I work for Mainline Foundation in the Netherlands. And we've been working on this project with several partners. I think we have a short hour and a lot of things that we would like to share with you, so I'll just be very speedy. Just very quick, this project is funded by the European Commission and under the Justice Program, one of the final action grants that they commissioned, and a partnership with several organizations from practice and research. And you will hear from most of them today. So we are a partnership of Mainline, Correlations Network, Rainbow Group, Positive Voice in Athens, Ghent University, Gaia Paris, Fixpunkt in Berlin, who had to catch their flight already, so they're not here, unfortunately, and IS Global. And we teamed up because we wanted to fill some of the gaps that there are in terms of migration, drug use, and in particular drug use amongst vulnerable populations of migrants. We have three pieces that were sort of work packages in our project. A research literature research, a community-based research, and then we created a series of policy papers and fact sheets. And we'll be presenting on all those three packages. We're starting with Marlene van Selm from IS Global, who will present a bit on the literature review that we started with in this project. And the floor is all yours, Lena.
Thank you. Can you hear me well? Okay, great. So yeah, like Max said, we started with an assessment of the situations, like what's known about migrants who use drugs in the scientific literature, and we did a database analysis, and then we did a Delphi study, which I will explain in a bit more detail later on. So first, the systematic literature review, just going through it really quickly. We used search terms focused on Europe, migrants and drug users. We used these for databases. And then the inclusion criteria, we looked at studies from 2010 onwards. So to make it a bit more like timely, only illicit drug use and first generation migrants. So people actually have the experience of migrating themselves. Then we found 18 studies and 9 studies like through other sources. And then the database analysis, we only focused on 8 countries because of resources, basically. What we did is we contacted the EMCDDA national focal points. 3 of them got back to us that they didn't have any specific information on migrants who use drugs. Then we searched the database for the global burden of disease. And we identified 2 relevant studies, but no real databases in that sense. And then in the Delphi study we asked the participants, do you have any relevant information? And we got 2 more studies from Belgium. Then the more interesting part, the results. So these were the studies. As you can see, it's very diverse. Like, it's very hard to compare. Also, the host countries that the studies were from were mainly Germany and Sweden, but also some EU-wide studies, some focusing on several countries. And then the countries where migrants were from were very diverse as well. Like, few Balkan states, few Eastern Europe, few Russia, and then also all over the world, basically. You don't have to read this all, but what this graph is meant to show is, like, on the right, you see whether these studies found that drug use in migrants was higher, lower, or the same. But as you can see, the populations were already very diverse, like some were among people, general population, other were among people injecting drugs, injecting heroin, living with HIV. So pretty impossible to compare. So this is not really meant to compare, just to see for you, like, how heterogeneous everything is and how difficult it is to actually draw some conclusions. These are the factors we found about increasing risks for drug use or decreasing risks. So poverty, living alone, trauma, lack of connection, loneliness, belonging. I think probably for all of you working in this field, this won't be anything new. And then the factors that decrease the possibility were mainly having a social network, having that sense of belonging, and being religious also. The availability of drug dependency services, there was very little information, because as you can see, this study, the data it shows is from 2007 to 2010, so pretty old, pretty maybe outdated even. And they looked at 14 European cities, the amount of addiction treatment services, so it wasn't harm reduction, and then the amount that were available for refugees and asylum seekers, or for undocumented migrants. And as you can see, there was like 10% or less, so a lot of work to be done there. And then factors related to access to healthcare services. And the main barriers were mainly language and culture, legal barriers, insurance, lack of knowledge about services, difficulty applying for social assistance, stigma, living in a closed environment with other migrants who use drugs, and that way not really being able to find the services as well, and also bad experiences with dependency service in the country of origin. Like, I remember there was some example of people from Iran, I think, that said, like, the service, we were just locked up, basically, and without any medical assistance, we had to get clean, so they weren't very keen on entering in drug dependency services in Europe. So that really quickly was the... wait, I actually have time. Okay, so that really quickly was the literature study. And then what we did was the Delphi process. So based on the literature study, the things we found, we drafted some statements, because there's not a lot of agreement within this field, within the literature. So we drafted those statements, and then we invited a group of experts on drugs or on migration to comment on these statements and to adapt them so they would so everyone would agree on these statements. So 57 people participated in the first round, provided us with feedback. Then we adapted the statements again based on their feedback, and we drafted some recommendations. Then we had another round where 84% of the panel responded again with their feedback. We adapted them again, and then final round, we adapted them again, and then we came up with these statements and recommendations. So the output of this process were 20 statements and 15 recommendations. And the agreement for the statements was at least 93%, and the mean was 98%, so that's very high. So we can basically say, like, those are 20 things that experts in the field agree on. And then for the recommendations, the same, even higher agreement. So we made 15 recommendations. And the recommendations broadly focused on the need for better data availability and quality, the need for more availability or better availability of services, better accessibility of services, and more cooperation both within the EU, but also within countries or within regions. Yeah, so I quickly included them here, but I think for the sake of time, I will just pass through it. And on your chair, you will find a policy brief, which include a QR code where you can find all the output from the whole SEMID project. So there you can take your time and look at the statements and recommendations if you're interested. So I think for now I will just leave it here and give the floor to Wouter, who will present about the actual field work we did. Thank you.
Okay, thanks. Good morning. The second work package was on concentrated on obtaining an integrated understanding of the local needs and experiences, and therefore in 4 capital cities in Europe we did a study among persons with a migration background who use drugs. So that's the abbreviation you see. Because I think it's very important to use person-first language. So the study was performed in Amsterdam, Athens, Berlin, and Paris, and we used a community-based participatory research method. I will soon explain what this consisted of, but mainly it's about involving these communities in the research with community researchers from different migration or with persons with different migration backgrounds. The focus was on exploring the needs of especially vulnerable persons who use drugs, and also what good practices are available and what practices are already working well in these 4 cities and beyond, but that was mainly explored in the Delphi study and also the literature review. This is the way we worked for this study. So CBPR is a research methodology for ethical and equitable research among very hard to reach populations, specific communities, and by setting up a dialogic process. We can raise the voices of those usually not heard in this type of research and this type of studies. To identify indeed problems and solutions to these problems. What I think is unique in this study that we had, like what you see like in the second bullet point there, we had a structure in which we had academic staff from Ghent University. We had local researchers in each of the 4 capital cities, mainly practitioners working in the harm reduction field. And then we had community researchers belonging to the specific communities we identified in each of these 4 cities. All of the researchers involved were trained during a 3-day workshop, and so we prepared them for performing the research, for executing the research, and how also to deal with any challenges or difficulties they would meet. Then, of course, people were followed up, and there was an advisory board following the study. Ethical approval was obtained. And I think important to say is that we recruited study participants through like gatekeepers who could be working in like services specifically oriented towards people with migration background or harm reduction services. So we also went to specific venues, usually harm reduction services involved, and the organizations involved in the study, which were mentioned on one of the first slides, and through snowball sampling. So people who participated in the study and who said this or that person could also be someone to be interviewed. I think very unique to this study is that we try to address the participants in their own language. So for that reason, we had 14 different languages that were spoken during the interviews, and Of course, that was a challenge to like transcribe the interviews, to interpret the interviews. Therefore, we worked with a translation office, Go Transcript, that was like a person-based translation service, transcribing all the interviews and facilitating actually the data analysis, which was done in English. And so all interviews originally performed in Georgian or any other language that is not really familiar to most of us, and these were like transcribed and translated and then analyzed. We also did focus groups with professionals in these 4 cities, but for the sake of time, I won't go into this. This can also be explored when going into the research outcomes. So there were 4 cities involved. I realized that the sample from Athens is not included in this slide, but you see from Amsterdam we had so in each city about 20-25 study participants were interviewed. In Amsterdam there was mainly people from within Europe who were like labor migrants who were interviewed, also Spanish-speaking persons and people from like an Arabic background involved in the chemsex community. Then in Paris we had a large Georgian and Russian-speaking community, so that were the 2 main groups interviewed in Paris, and also I think people with the 3rd group in Paris is below, people from Somalia who were interviewed. Then in Berlin, we also had people with Russian or Russian-speaking people from Baltic countries, from Russia and other neighboring countries, and also a large community from West Africa and from the Maghreb countries, the north of Africa. And in Athens, we had mainly participants from the open drug scenes, which are like migrants with very diverse backgrounds, then also people from sub-Saharan Africa and people from North Africa. So a very diverse sample, but I think the unique feature of the study is that they were all addressed by community researchers belonging to one of these groups, who were sometimes people who use drugs or people working with these communities as part of their job, or volunteers, so it was also a diverse sample. Just a quick introduction to the results, because I said that I only have 2 minutes less. So I think we collected a lot of quotations from people, and I think here already the diversity of the findings is shown. Like some people came to one of these cities without having used drugs before, who came or who were introduced into drug use, and which was attributed to, I think, what was already mentioned also in the systematic literature review on loneliness, trauma. And when I go to the main findings, I'm sorry that this is a little bit small, but I think what is clear that there was a huge heterogeneity in the sample and also in the findings. And so when we talk about people with migration background who use drugs, this is a very diverse group, different languages, different nationalities, different countries of origin. But what stood out to me is like the vicious circle in which people end up. We were already, I think, shown based on the systematic review of the literature that people struggle with homelessness, with lacking papers, resident permits, being unemployed, but actually being homeless, and the fact that you don't have a residence permit, it induces that you cannot look for a job, that you're not entitled to health insurance. People start using drugs to cope with these problems, and so end up like in a circle which is very hard to break through. Also psychological distress induced sometimes by migration or by things that happened before, or by anything that happened after moving. Limited social networks, I think that's also very clear. People often have family abroad and are or feel socially excluded because they do not trust people here, they do not trust services sometimes, which also increases the barriers to help and to services. Basic needs are often addressed quite well, thanks also to the harm reduction services involved in these cities. So food, shower, shelter, especially in winter. These interviews were performed in winter time. That was addressed quite well. But when it comes to the accessibility of healthcare services, then people struggle due to what I already said, not having documents, etc. Opioid agonist treatment is most often available. Athens was an exception because people are not entitled to getting methadone in Greece if they don't have official documents. What should I pick out more, because the time is very limited. I think the mental health issues, that is also something that stands out. People sometimes do not want support for that, cannot access support, especially also because of language barriers. And talking about mental health issues, I think it's very important that you can express yourself in your own language, because these feelings are often difficult to express. Something important regarding Ukrainian migrants, because, and I think it was mentioned yesterday too in the workshop, that people from Ukraine experience far less barriers, and I think services did extra efforts for people from Ukraine, which can maybe also be a good practice and can also inspire services to work in the similar way to address the needs of people with diverse migration backgrounds. And then the last slide, I think really we need to address people's housing support needs, emergency healthcare needs, which are often addressed, but also the healthcare needs that go beyond that, for instance, HIV or hepatitis C treatment. I think jobs are very important to also be able to escape from the vicious circle in which people are trapped, because it can allow them to earn money, to maybe find a house, but of course, not having a house, it's very difficult if you have to sleep on the streets and then to prepare for a job application or whatever. So it illustrates clearly the vicious circles in which these people are trapped. And what was also very striking, I think, that people described the encounters with criminal justice system, with the police, as overall quite positive, but prison was often experienced as a period in which they had stability in their lives, in which they had structure, in which they had food, which was often not experienced as something negative, which is, I think, also a striking point. And the last I would like to say, according to United Nations, healthcare should be available to all, be accessible, affordable, culturally sensitive, and of good quality. But I think, according to the voices of the people we have heard in this study, this is not at all the case, and I think there is a lot of work to be done, and we hope that this project can contribute to it. So this is also a big thank you to all, especially the local and community researchers involved in the 4 cities who facilitated the research, and without whom the study would not have been possible. Thank you.
So, Ari, you can take the stage, please. So, thank you, Wouter and Lena. I think all of this was translated in several documents, and Ari from Correlation Group will present that to you now.
Hi, all. I will briefly introduce you to the work that Correlation did in the work package for SEMID. What we did is taking all of this knowledge that was produced throughout the other work packages, so in the situational assessment, but also with the results of the interviews carried out in the CBPR and with the results of the focus groups, we produced a series of documents that are recommendations for policy and for practice on a local and a European level. So, briefly introducing, the policy brief is what you have also on your chairs and is the most extensive document of this collection. And it includes extensive background information on the situation of migrants who use drugs in the EU, so basically information on the state of play. And not only, it also includes information on the specific barriers that migrants who use drugs in the EU face when they try to access services that might help them. And lastly, this document also includes specific recommendations for policymakers. On the other hand, we also created other resources. We have created a number of fact sheets. Some are general, so they relate to the whole EU level. And there's two different fact sheets. One is for organizations that work in harm reduction, and one is for organizations that wish to support migrants, and I will go more into that later. We also have created a checklist that is supposed to support services that want to help migrants who use drugs. And then we also created 4 local fact sheets that are focused on the specific situation of the 4 local cities where the CBPR was carried out. So Amsterdam, Athens, Berlin, and Paris. So zooming in on the documents, as for the policy brief, as I said, it includes background information on migrants who use drugs in the EU. It includes information on the barriers they face, but not only. It also includes like specific recommendations that are aimed at policymakers to better support migrants who use drugs in the EU. Here included some of the main fields in which these recommendations are articulated. So the importance of upscaling the availability and accessibility of services, but also of having standards of provision, quality and accessibility for health coverage in EU member states. On the other hand, we have also seen with SEMID that there's a strong need for an increase in data availability on the topic of migrants who use drugs in the EU. Of course, eliminating major barriers for migrants to be able to access these services, drug services and harm reduction services is fundamental, and there's recommendation also in that field, and how to actually facilitate their access to further care and support in different areas of their lives. We stress also the importance of collaboration among and within EU countries, and lastly, of course, we include recommendation on advocacy for harm reduction principle and practices, and to raise awareness against all forms of stigma, discrimination, and racism. Now I will tell you a bit more about the general fact sheets. As I said, they include information on the whole EU level, and these 2 separate fact sheets. What we conceptualized is to have one fact sheet that is aimed at organization that works in harm reduction, and the one fact sheet that is aimed for organization that wish to support migrants. And the reason why we did that is that we wanted to facilitate the support that this organization can give to migrants who use drugs by reaching better this population. So on one hand, for harm reduction organizations, we give information of why it is important to also implement migration-informed practices, and on the other hand, contrary to that, we give information aimed at support services for migrants on why it is very important for them to implement the harm reduction framework and harm reduction practices. And this is all aimed at supporting migrants who use drugs that might need specific interventions, because, for example, like harm reduction services that are aimed at people who use drugs maybe do not take enough in consideration the specific conditions of migrants who use drugs that are different from maybe the other participants they have. And on the other hand, for support services for migrants, implementing harm reduction practices and low threshold services can be really beneficial on reaching migrants that maybe have different needs, specifically because they're migrants who use drugs. So this is the aims of these two documents. And as I said before, actually, we also have created a checklist that is aimed at further supporting the services in carrying out a review of their own services and assessing what they might need to develop to better support migrants who use drugs. And lastly, we also analyzing the information from the community-based participatory research and all the information that came out of the interview. We have a very clear picture of the situation in these 4 cities and specifically within the migrant communities that were selected as more relevant. And thanks to that, we developed other recommendations that are meant both for policy and for practice that are specifically tailored to the needs of local communities, their challenges, the availability of services in the city, the access to services in the city. You can find all of these documents in paper here, but also online through the QR code created by Mainline. And yeah, I wish you a good read.
Thank you so much. Maybe just to make this a bit more practical, I would like to invite some people to the stage to have a bit of a discussion on this this topic. So maybe Victor, did you decide with Elizabeth? Is it you? Yeah, Victor. Ingrid, if you like, or Joanna. But Ingrid is on my program. Claudia from EMCDDA and Dennis. Can you please come to the stage? And while you do so, I think one of the things that was striking to me is the importance of harm reduction services in this field, and yeah, also the lack of recognitions that these organizations get in terms of being in the front line, going the extra mile to work with people, to help them, also give legal support without resources usually. So from my perspective, definitely something to fight for if you talk about advocacy. Oh, you're very quick. Joanna is replacing Ingrid. Oh no, she's there. Sorry. So maybe just to start with a bit of a practical angle. Victor, you're working for Gaia Paris. You can just press the button and the mic goes on. What have your experiences been, and what would you say is your most pressing message to the audience?
Well, we have always trying to adjust our services to the communities that we were meeting in the streets, being mostly an outreach program. And the communities we meet are always evolving, and we are trying to have this constant effort to match their need. But it's not always easy to know and to understand their situation and to find out what is clever thing to address. Participating to this study was really interesting for us because we had the opportunity to value the lived experience of the people that we were receiving in our services, and I mean value not only in a symbolical level but always also with financial compensation for those people, which is really important because those people are telling their stories so many times, they are sharing their experiences, and oftentimes it's just a way to enter services and it's not value at its proper level. First of all, we tried to access 3 communities, and we had to pivot at some point when we realized that one of these communities was not accessible with the plan of the study. We were trying to address a community that comes from India and is a community that is a client of our methadone treatment center, but those people are moving outside of the city a lot for working reasons, and they are very difficult to access because of those reasons of working on a black market for immigrants, which can be very difficult and not regular. So we could not gather them and have proper interviews with them, and we had to pivot, and thanks to Datuna we could address another community which were Russian speakers outside of Georgia. We discovered a few things about the Somalian community by having interviews with them in their own language. We figured a few things that were matching their need, but addressing them in their own tongue was a new way to reach them and to once again value their experience. So we were really happy to participate to this study, first of all to adjust our services, but also to gather data at a European level, have the strength of university-based research, use the lived experience of the clients of our services, and also work on the advocacy for service for migrants who use drugs.
Yeah, and I think one of the interesting things in this research was also that we could compare a bit the different cities and also the role of law enforcement in the different cities. Maybe before we move to Amsterdam, what can you say about the role of police in this field in Paris?
Well, it's a bit it's a bit difficult, but we are addressing communities that are most of the time visible minorities. They are illegal by just being there as illegal immigrants for most of them, and they are also in a situation where being a person that consumes drugs puts them in another situation of being illegal. So they have first of all the visible minority stigma, then drug use, and then being illegal on the territory. So it's very hard for them, and it's people that live in a, I won't say fear, but a constant state of being really aware of everything that's going around, and always not in a paranoid state because it's based on reality, but very vigilant all the time. And providing them with safe spaces and a place where they are addressed with dignity is already something huge.
Yep. Thank you. Joanna or Ingrid, or a duo, what can you tell the audience about Amsterdam and maybe your most pressing message to maybe local politicians or services?
Yeah, I think maybe I can speak about the European group migrants. Yeah, and then you can speak about the chemsex group. Yeah, in Amsterdam, we focus mainly on European migrants, also because where we collected data in AMOC, we focus on this community. And what we saw, I do have to say that most of the participants were in the drug consumption room, so of course that already gives you a different access to services. They were at least accessing this service, and they were very happy about it and very pleased with this access. So I do think that for European migrants, the most pressing thing is the next step. So most of the people that we talked to, they did have access to basic needs, but that was it. So at the time, namely in harm reduction, they were not accessing methadone. Now it's a bit different because social workers have worked, and the Regenboog has worked in advocacy activities that are leading to the group to have more access to methadone now. But back then they were not. And there were some issues related with access to health, and then the methadone was because they didn't have health insurance, and then they didn't have access to GP. So health is quite an issue in the sense that people don't really have access to the most basic care, only in emergency, and only through like organizations like the Red Cross. And then there was also a very pressing need for a stable place to sleep. And we say stable because at the moment that we did the interviews, it was winter, and in Amsterdam, in winter, there are more temporary shelters that are open, and most of the people did have access to that. But what happens then is that people cannot build a life on that. If they are working and they don't know where they are going to sleep that night, or if they are not sure if they are safe in the place they are sleeping in, they cannot really progress, and they cannot have a real life goal. So they struggled a lot with that, and they still were trying, they still were going to work while sleeping on the streets or being in these temporary housing situations, which is quite demanding. So I would say that that's quite a pressing need. And then I would like also to refer that we try to reach out to the Spanish-speaking community, as we learned from other clients that that was a community that was showing up a lot on the streets, and that was using a lot on the streets. And actually, we did find a lot of barriers to reach to the community, even trying to access grassroots organizations. We were not so successful. And from the ones we did interview, we did realize that there is a problem with the service at the moment for these migrants that is stuck with the higher threshold of our services that demand, for example, that they are identified, so they give their identity cards and their names, and that is already a barrier for people that are very used to repressive systems and to the stigma related with drug use, and then they don't want to be associated with it, so they don't come to the services. But also people that are smokers and not injectors and find more comfortable to use in private spaces, and then services do not reach to these people because they are in a group, and they also sometimes feel uncomfortable to be next to injectors. So that's also something that is quite interesting for us to reconsider in the services in Amsterdam. We all know that drug consumption rooms specifically are quite well based in Amsterdam, but now we need to take the next step and see how can we improve them and adjust them to the communities that there are in the city at the moment. Do you want me to talk already about the law enforcement, or?
Well, your time is up, Joanna. No, just to give a bit of space, because we have so short, we only have an hour. Sorry to cut you short, but it's an important point. And the police in Amsterdam was received or perceived as quite positive, actually. I think one thing that is clear is that we're talking about people with very, very diverse backgrounds, not only in terms of nationality, but also in terms of legal status. So we spoke to people who were undocumented, people who came from EU member states, but also people who have a refugee status. Ingrid, you or together with our colleague Sultan, we did some interviews with people from the chemsex scene. They often had a refugee status, but were vulnerable in other ways, right?
Yeah. So originally we didn't plan to do anything with this target group, but we at Mainline we focus on the chemsex group for quite some years by now. So we also thought to take this opportunity to involve them. They're like, at the first sight, they may not seem like the typical marginalized drug user. They're not on the street. They have like a permit. They have like a stable. Their first basic needs are usually covered. They have social. They have an income. They have housing. But they're in other ways quite vulnerable because we were focusing on men who have sex with men. That come mainly from, we interviewed 5 people from Syria, and they came here as a refugee because of the war and because they were fleeing from a country where their sexuality was not very embraced. So they had mixed reasons for coming here, and also mixed hopes of their lives here. What was striking that they often end up in the chemsex scene through dating apps. So it's a very different dynamic than most of the other groups that we found in this research. And we also saw that their needs were a little bit different. We saw mainly that they were having a need that was more focused on, for instance, trauma-informed care in their own language, because there was a thing that's not really available. And in general, you would say like the chemsex care is not really evolved yet. So there's basic things like groups for just talking among each other, but harm reduction is not something that's there yet for them. But in general, not so much available yet. where was I going? It was mainly mental health services that they would need, and I also found that they often come from a country where they don't really have a lot of experience with drug use, and then they come to the Netherlands. They look for in the gay community, they look for belonging, they look for connection, end up very quickly in the chemsex scene, and they get in contact with drugs they have no idea about. Mm-hmm. So they end up like from using nothing to starting with crystal meth or other intense substances, and they wind down quite fast. So yeah, it's different needs, and but it was I think it was very valuable to address their needs in this context as well.
Mm-hmm. Thanks. And for our project, we also had an advisory board, and there's two members from our board here. Member Claudia, the mic is with you, so please go first. You work for EMCDDA.
Yeah, thank you very much.
Thank you for guiding us through the project also. Can you give some reflections from your end?
Yeah. Thank you very much. And I think, first of all, I would like to thank you for this project. And I think really we realize how much of information and insight we are gathering. And even if these studies were conducted at the local level, I think we see a lot of commonalities, in how people are struggle, what are the barriers, what are also the responses. I think from the agency level, I think we have to keep in mind that EU is committed to work in this area, and we have EU Drug Strategy 21-25 that calls for access to treatment for this vulnerable population. We just need to collect information and see if this is happening. What we see already, and I think what this project is giving us a light on, is that there are many difficulties, and there is still a lot to be done, mostly at the national and local level, and this is where probably our limitations are coming as well as an EU monitoring agency. But also I think few reflections. First, I think there was a lot of discussion about silos, and I have to say we see that from our perspective as well. We are drugs agency, but we've just started a collaboration with the asylum agency that is based in Malta. And actually we did a study on substance use among applicants for international protection. And that's what you were saying as well. I think we as a drug specialized agency are discovering really this complexity of the issues and what we consider as migrants, what it means in terms of their rights and access to healthcare. But in any case, I think one of the really important conclusions from our collaboration with the asylum agency once is that we have a mapping of the needs of people working with migrants, asylum applicants, and also the need for collaboration, and that's why, and the training. So, for example, people working with applicants for international protection, they are dealing more and more with drug use among these populations. They were signaling this to us. They were contacting our agency, and that's how we started this collaboration. And they are always saying, it's a new topic to us. We are not really experts in this area. We really struggle to find information. And this is one of the ideas we have, is next year we will be developing a training module for officers working with in the reception centers in the EU. So I do hope that we can also learn from your experience and the materials you have as well. And maybe a few other observations. Once I was checking today, this morning, the statistics of the asylum agency on applications lodged. So how many people applied for asylum in the EU? And only between January and August 2023, we have 700,000 applications. Yeah, so we talk about this migration crisis 2015, but what we see is that annually we have around 1 million of people applying for asylum in the European Union. So I think it will have a really great implications on our area of work as well, and how the migration is tackled, how we are working together as well, and this intersectional collaboration and tackling these issues from different perspectives, we find it as a very, very important point.
Yeah. Thank you. Talking about silos, well, Dennis represents the other silo, and I think is doing already some great work to build some bridges. Dennis, would you like to introduce yourself and your organization, and then maybe share some reflections from your end?
Thanks, Mark. So I'm called Dennis Onyango. I work for an organization called Africa Advocacy Foundation, which was started about 26 years ago in the UK. because of Brexit, we've managed to be registered in the Netherlands. So we run a project called My Health Europe, which is working in 10 European countries at the moment, mainly on HIV prevention and STIs. But as you know, a lot of issues we deal with are intersectional. So when you're supporting a migrant, when you conduct outreach or you interact with a migrant, there are many, the chances are that you're going to be dealing with more than just one issue. So that's the way it is. And so I think for us, based on our experiences, really, as somebody who's working in the front line, and I know that this project has done great in terms of coming up with a policy brief and again the experiences from the 4 countries around how they're working with migrants and the challenges have been highlighted. So I know I'm preaching to the converted. You all are specialists in your own respect, so there's nothing new that I'm going to say. But I just want to emphasize a few points based on as organizations working in the front line with migrants. I think that one of the key issues for me is really around mental health. And the reason I say this is just because a lot of people that we support have actually, through this trajectory of migration, have encountered a lot of trauma and very difficult experiences, right from Libya in North Africa, sexual exploitation, violence, that treacherous journey through the Mediterranean, landing in Europe, hoping that things are going to be better, and they're met again with very, very hostile environments. And so drug use amongst migrants is not really a recreational thing. It's more about a coping strategy for most people. And therefore, I think that when we are designing services, we should be able to have culturally competent services. But this, I mean, really not just understanding people's languages and okay, yep, it's working. So trying to really look at the various needs. So I think that one group that we've not actually touched on is the young people. So we are working a lot with young men from Eritrea and Somalia. And even though a lot of drug, most of them are using, of course, marijuana, but and very little heroin and crack cocaine. But you still see that a lot of them are kind of stagnant in a way because their lives are not moving forward, not going anywhere. So they have to find a coping mechanism, and that's something. I think that the issue really is around awareness around what drugs are, because our backgrounds really are drug use is stigmatized. First of all, there's very little knowledge about it. There's misunderstanding about it. People actually in my community don't consider alcohol as a drug, so there's a lot of widespread consumption of alcohol and alcohol abuse, and no one talks about it. Same thing, we're talking about prescription drugs. There is a lot of abuse of that, and again, to be able to cope. So I think that all those have to be looked at in that respect. But I also think that the issue, I know a lot of recommendations have been given, but I think the issue around discrimination and racism, it's just not, and when I talk about migrants, it's not just undocumented migrants. There is a legacy of colonialism, of racism, and all these are in systems. And we all work in systems that are trying to do our best to make things better. And we are all trying to do our best, but we're kind of disabled by the kind of systems that we're existing in. And so if you are a professional trying to work with a migrant, and you have a system that are criminalizing somebody or barring someone from access based on their skin color, I don't think it's just about legality or being documented. We have seen how racist Europe can be in really, because over the past 10 years we've been seeing issues. People from Syria, from Middle East, from North Africa, Horn of Africa, being treated very badly and being the scapegoat. And then, of course, the terrible tragedy in Ukraine happens, and then you see a very, very blatant case of racism where one community can have unfettered access to services and the others are not. And, it's not just about, from the lens of a migrant, it really is very painful because, you cannot support somebody because of just, I think it's about the color of their skin. It's black and brown people. So I think that we need to look at this. So as we work on advocacy, as we work on services, let's try and find a way of being able to engage with policymakers around some of these issues on a human-based, human rights approach or basis, on an ethical basis, and also public health and economics. We know very well that when we reach people at the point of crisis, they will inevitably, it will cost us more. But also from a public health perspective, we owe it to everyone. I mean, if everyone is safe, then all of us are safe. And you cannot have a situation where you have a section of community in the margins and you think that you are a civilized society. So I think that these are issues. And I think for organizations, we know that we work under very difficult circumstances. We are not funded enough. But I think that we can be the advocates. And I think what we see in HIV, and I think Ferenc is in the room, he will agree with me, yes, is there, is that we work very closely with doctors. So doctors are some of our greatest champions. So if we can actually, in the harm reduction field, try and engage with doctors and have those as our advocates, it will be really, really good. The other issue which I want to wrap up with is just around trust in services. So a lot of migrants we work with do not trust services because of the way they are being treated. And, you know, we've talked about using peer mediators. You know, when I speak to somebody or when they read some information somewhere and they ask me and I reassure them, they will take that as a gospel truth. So investing in peer mediators, investing in people who understand the languages, the culture, the faith backgrounds of these individuals makes a huge difference. So I think those are just some of the takeaways. But I mean, it's all there really. And you all have done amazing work. You've got various experiences. So there's nothing new I can say. But I just want you to take a moment and look at each case, because behind every migrant there is a story. And I think that's the takeaway thing I would like you to take from here.
Yeah, thank you so much. Yeah, I think it resonates with the final message that we would have. I already said, like harm reduction organizations and services play such an important role in this front line in a very difficult field to navigate, where there's so much political pressure around migration issues, but also around drug use, more public spaces where people are using drugs. And that combination is a very difficult, explosive field, politically speaking. I think, for services that are struggling with this topic, our message, I think, would be it doesn't matter where someone comes from and what their status is, harm reduction access is a human right, and there should be no obstructions. So that's, I think, a cry out from our side. Definitely a lot of work to be done. I think I would also say that if we speak about harm reduction, we're talking also about the right to shelter, which is definitely something that people struggle with, of course, to access. If you want to disseminate more about our projects, please take all these nice publications. And we also have a digital publication that's more in a magazine form, maybe more accessible for people you work with. You can find it through this link. It's basically a Mainline magazine, but on this topic. And it also includes some personal stories, because sometimes that resonates better with people that you work with, to understand a bit what is the situation on the street and what are people's perspectives, in addition to more let's say the theoretical recommendations that we made. We have no time left, but please come to find us if you want to talk more about this topic. We'll be around. And thank you so much to the panel. Big round of applause. And to our presenters, Ari, Lena, Wouter, thank you so much. And have a great rest of the afternoon. Thank you.
Yeah? And Marta, here she comes. Thanks, everybody. Another great plenary session there. It's good to see so many of you here as we get towards the end. We'll be drawing the event to a close. Tony Duffin, I'm the chair of the advisory committee, and on behalf of the advisory committee, I'd like to thank you all for such great participation over the last number of days. I just want to say a few words really. I mentioned at the beginning the other day about our shared ethos, and I really believe it's something that we have as a network. We have a very strong network. We must nurture our ethos as a harm reduction network and not take it for granted. So I would just want to mention some elements of our network, and that is, the staff, the team. Katrin leads the team. They do some absolutely fantastic work. We have a great strategy being developed. We have fantastic membership. We have a great new identity. We have a logo. We have branding. We have a website. We have a strong identity. So we can look forward to 2024 as an exciting year ahead. We will be busy as a network, I think. You may face challenges when you get back to your own countries, your own jurisdictions. Remember that the network is here to help. We may have opportunities that are presented to us both as a network, but as members of the network. And again, we're here to support you in that regard. Just want to acknowledge that just as we go forwards. Now we're going to have a session. We've got Péter, Marta, and Katrin. Peter's sorry. Hang on, get the right order. Sorry. We're going to have. Is that the right order? Sorry. Yeah, Péter, Marta, Katrin. Yes, sorry. Yes. Péter's our man on the ground in Hungary, and is going to offer some reflections around the experience over the last few days. Marta's going to offer some reflections about the deliberations and such over the last few days, and Katrin's going to help wrap up. And then we have a little video of the event. Isn't that right? So thanks. Yeah. So it's Péter first. Yep. Cool. Okay. Cool. Thank you, everybody.
Actually, I don't have slides, so I don't know why are you opening them. I just
for this, very organized here.
So anyway, it was my great pleasure to have you all here in Budapest. But apart from improving my well-being, this conference also had some impacts in Hungary. Maybe some of you know that yesterday we had a press conference with some people from EU speaking about international best practices such as drug consumption rooms, drug checking services, decriminalization in Portugal, and the largest television, RTL, had an evening news report yesterday, and we had delivered the message, which is really liked by Tony, that harm reduction works, to hundreds of thousands of people who were watching television. So I think it really could have an impact. My colleague István has worked a lot on creating a movie of this conference. Actually, he worked until 5 o'clock in the morning, as I've heard. So it was like really hard work, because it's, like editing this movie, it's like really hours of work. So I really appreciate that. And we also get some comments, we always get some comments that why don't we just organize these conferences online, because now there is digital communication and we spend a lot of money. But I think there is something which online communication cannot give back, and this is like holding the space together. And there are so many really useful and important conversations going on, even outside of the official sessions, and new partnerships are created, built, and new connections are made, and new cooperation projects are just being created now, and maybe the future projects are being born at this conference. So again, thank you so much. And also, as I told you, this building is now empty of students because the Central European University moved to Vienna. So this campus is now just, it's a building, and they let it rent for conferences like this. And I think there is nothing that better fills this space than people coming together and speaking about human rights and harm reduction. Thank you very much.
Yes. Yes, it's okay. Age. I have the same problem. Hi everyone, happy to be here. I want to thank all the people that cooperated with me and Filippa getting the data for this, and also to C-EHRN, because they are also always very open to help us in everything with the evaluation of the work of the network. I'm very small besides being old, so I'm going to talk like this. Thank you, Tony. Very much. So, only 5 minutes, okay? I will take the presentation. We are the external evaluation team of the C-EHRN. Marta, I am Marta, and Philippe is there with me. And this type of photo to present this says a lot about this type of events and about the network, because I wouldn't use it in another type of event like this, only in correlation. And just to give you an idea of the methods that we are trying to use to do the evaluation, we always inspire ourselves in the ethnography methods. So quantitative indicators, a satisfaction survey that I'm going to ask you please to answer while you are here at the session, because your opinion is really crucial for the network to improve and for us to understand what needs to be done. Observation, visual analysis of videos of photos, I will use some of them in the presentation, and documental analysis of the session reports, because there's always somewhere someone taking notes of what is being discussed. And we want to use also the social networks comments. So if you have anything that you would like to say about the meetings, go to the social media, because we will analyze the materials and your opinions and comments there, okay? So thank you. Some preliminary results. We have around 130 people attending the meeting, 15 sessions, 75 countries represented around that, 40 focal points, and many activities like a workshop linked to a new movement of Hungarian people using drugs, which I think it deserves an applause also. The press conference that you already spoke about, site visits and so on, and diverse outputs and outcomes that you already mentioned. Some field notes about our observations, a summary on that. A very informal and participative atmosphere, very close and affectionate relationships between people, strong commitment with real impact in the communities with which you work with. Deep engagement in the working sessions. You are always working hard, not distracted with the cell phones and so on. And I think it seemed to us that there is a very good balance between work and pleasure in this conference. It seems that C-EHRN staff had the preoccupation of taking care of us with good conditions, good venues, good food, good location and so on, and people were saying that on the interviews. So very rapidly, a very good organization. I put there some quotes of the interviews that we have been doing while the meeting was going on in those days. Perfect organization, very professional work, also a strong program, very full program, which is both positive and negative. Exchange moments, particularly useful for those who are here as focal points. It's really nice to have this event. It is exactly what I was needing, one of the quotes. And a powerful social atmosphere. C-EHRN really seems like to be a pillar for emotional, technical, and even ideological support. It seems sometimes that it functions as a coping mechanism for you to deal with the difficulties that you find, the obstacles that you have to find on your quotidian life as harm reductionists. And some quotes about that. Those are key moments because of the networking between members. Some of us are completely isolated, and it is very important that we can recharge agency and go back enthusiastic to our countries. Correlation meetings are really special. You don't see this kind of atmosphere anywhere else. Those people are friends sharing the same vision. And I really enjoyed the meeting so far. It feels very familiar. The word family and friends always appears on the interviews. Just a few words about the network as a whole, not only the meeting. The hard and high quality work of the C-EHRN staff was highlighted very often. We didn't get almost non-negative feedback, but it might have to do also with the fact that we are the external evaluators and people want to be nice to the network. But please fill in the anonymous, surveys that we will offer you. They work very much, maybe too much, Katrin. People are worried with you, with the team. There's a huge amount of work, but I believe they're in their capacity to deal with it, and this is high quality work. Also, people highlight the C-EHRN unique and precious character. It feels like a family. C-EHRN is the jewel of the crown. We heard this several times. C-EHRN focal points are the jewel of the crown. The relationships those people have across Europe are golden dust. And C-EHRN is filling the blind spots of the other organizations and networks. It covers local level and gives the chance for this networking. I'm really happy about it. And just to finish, challenges that C-EHRN might face in the near future: the political hostility environment, scalability because of the growth that might be too fast to manage, and sustainability, financial sustainability mainly, and national and local representativeness of C-EHRN members. How representative is a representative? This interviewee said. And the last one, some tips for improvement or for the future. Once again, because this already happened last year, C-EHRN should get more conscious of the self-value. Correlation must be aware of its value because it does what no one else is doing. We must double down who we are and what we believe in, plan for the worst and hope for the best. Stimulate and multiply face-to-face meetings, networking moments, and stimulate the spontaneous and regular contact between members. Influence national decision-making while protecting local harm reduction organizations. And the quote was, raise the difficult subjects without damaging the relations at national and subnational levels. I'm thinking about Hungary, I don't know why. The most important thing is co-production, co-design, and co-delivery. Anything we can do to involve people who use drugs will strengthen us. And I finish with a phrase of one of the interviewees: the C-EHRN future is bright. Katrin? So please, now we are going to pass the video. No, you will start. But when will people start to?
I cannot.
You say that.
You cannot. Yeah. So, first of all, I think thanks Tony, Péter, and also Marta for wrapping up. I think this was heartwarming, and we are really very happy about the meeting ourselves. And I would like to say, every time when we say CERN is super, CERN is great, super work, super meeting, this is us, right? I mean, we are all together in we are correlation, and I think without you, without the members, without the focal points and all the experts here, we wouldn't have had such a great meeting. So I think to you, thank you very much. I'm saying some closing words, but for now, you see this QR code, and while I'm speaking, this is not a big problem, you can already start filling it in. So, except the fact that I want to thank all of you. We will now go home. I think we received lots of input during the session and the working group sessions and so on. We will now collect all the information. We will prepare a report. We will share all the resources, including all the presentations. So we'll get all of this. And we will use your input as well for our strategy, which we are currently developing, and also for the work plan, as far as possible, at least. Still, I mean, we received all kind of positive feedback now, but I would like to invite you as well to be critical when you fill in now the evaluation form. But also when you feel there is something else you would like to share with us, please send it to us. Let us know if you have questions, ideas, or whatever. I now give a few thanks to people. First of all, I think Péter and István, they deserve really a super thanks again from our side. I think for us it was a real pleasure being here, and I think Péter has deserved a meeting like this and many more in Budapest. This country is clearly suffering, and if the meeting just a little bit helped for this, I think it's great. We have cooperated with Péter and István for so many years, and yeah, they are not only colleagues and but also very dear friends. And thanks again, István, for the night work. I think, yeah, you always work super hard and very good. I also want to thank Andrea and Sylvia. They are not here, I guess, but these are the two persons which really organized within the Central European University here all the rooms, and they were really very flexible. Tony Duffin for helping us to organize the meeting and moderate all the difficult sessions. All our experts and consultants, which is Tuka, Dan, Graham, Marta and Philippa, Beatrix, and Mireia and Adria from the Teddy Network, and all other who contributed in the working groups or wherever. I also want to thank Matt and Lynn for being here with us and really supporting us, not only during this meeting, but also throughout the last years. I think the cooperation with Euro Input for us is really essential, and we hope that we can intensify this cooperation in the next year. And also thanks to Machteld from Mainline and her team, and to Péter and the team of Trimbos for bringing their projects to our meeting. And I think this also creates additional impact. So the drug prep project and the SEMID project. So all of those I have mentioned now should come later on to here, but I think the biggest thanks should go to Steph and Leah, who have really worked very hard and organized everything. And now we are showing the final movie from the conference meeting. Let me see, I do everything right this time, yes. I think 23 was an extremely busy year for us. We have done loads of activities, and when I'm looking back, I'm extremely satisfied and very I think 23 was an extremely busy year for us. We have done loads of activities. And when I'm looking back, I'm extremely satisfied and very proud on what we have achieved. We have a new branding, which shows a little bit the new, more modern identity of correlation. We develop a new website, which will be launched at the end of the year.
We are developing at the moment a strategy for Correlation European Harm Reduction Network until 2028. we already have main directions, and these directions include the development of and maintenance of the strong harm reduction movement in Europe, fostering civil society involvement in policy and community involvement in services, finding new allies in different areas, but on the other hand, strengthening the network and membership that we have at the moment. We focus also on promoting evidence policies and human rights-based policies. This also includes decriminalization as the evidence-informed approach to drug policy and to drug laws. The fifth strategic priority is focused on promoting person-centered approach in health and social services to ensure continuity and holistic care for people who use drugs.
This year we had 5 different volumes for the monitoring report. So we worked with the accessibility and availability of harm reduction services. We also looked into hepatitis C care for people who inject drugs. And for the first time, we looked into the mental health challenges of harm reduction staff. We also then had city reports, 5 city reports. So we are looking more into working with advocacy and more with the local context of people. And we are also putting some effort into trying to make the monitoring report and the data more accessible for data-driven advocacy for our focal points. And also we are looking into new drug trends. And for the first time, we also made connection with the TEDdy network.
With TEDdy, we are providing the information and the knowledge about drugs, about drug trends. With TEDdy, we are monitoring the drug checking services. And we know that in correlation, most of focal points, most of organizations don't have drug checking services, so we are trying to provide with this knowledge.
Involvement of civil society is very important for correlation network. We created a study with a focus group methodology in 4 countries, in Finland, in Greece, in Hungary, and in Ireland. In all of these countries, we assessed how meaningful civil society involvement is, and we published a report about the findings. In all countries, it was common that civil society uses mostly informal channels to communicate with the government, and it was also a common theme that governments are always more satisfied with the process of involving civil society, while civil society was very critical in each of the countries. It is very concerning to see that the involvement of civil society is declining in all countries we assessed. There is a phenomenon we call the shrinking space for civil society. That is that civil society organizations often feel scapegoated, stigmatized because of their critical remarks on the government's drug policies.
We have coordinated a European project through the Justice Action Grant on vulnerable migrants who use drugs across Europe. A very important and urgent topic because we see more and more people with migration background in the streets across European cities. There's no real European or even a national response. And it's quite a complicated issue with all the political tensions around the topic of migration and harm reduction and drug use. So we figured we want to know what the situation on the street is like for people with migration backgrounds who use drugs in different cities. We looked at Amsterdam, Athens, Berlin and Paris. Some of the things that we find is that access to harm reduction services is really important for people. It's often the first place where people go and usually the only place where people are in contact with nationals. A very important place in the front line where people can access not only health services but also often legal services. Definitely something to advocate for is that harm reduction services should get more funding for all the extra tasks that they do.
In 2023, one of the main projects that Correlation European Harm Reduction Network was having was the European Network of Drug Consumption Rooms. And then within this project, one of the things that we did was to formalize the network. And it's a network that brings together organizations that they operate a drug consumption room or they're intended to plan a drug consumption room to offer mutual support, collect data, create advocacy. And then on the realm of advocacy, one of the things that we did was participating in the European symposiums on drug consumption rooms that took place with the Council of Europe in Strasbourg. Also, a lot of effort has been given into building capacity of organizations that wanted to open a drug consumption room. So building in the training manual that we developed last year, we have implemented 2 trainings this year, one in Slovenia for 2 organizations and another one in Brno, in the Czech Republic. And we will create a new publication that will support the development of quality standards for drug consumption rooms.
We are looking at developing a toolkit which will help NGOs to engage with prison administrations with the ultimate intention of developing health services in prison and specifically harm reduction. The fact-finding we've done so far has indicated there are very few NGOs doing this kind of work in Europe. A lot of people who use drugs pass through the prisons anyway, and so it would be a natural development, to help prison authorities to, whether formally or informally, accept the need for these kind of services.
The Busz project is a European project in the field of harm reduction. We have 3 years to find out more what are the gaps in harm reduction, where do we need extra efforts to improve the life of people who use drugs. And we found many interesting things already, that services are very often not very nicely organized in terms of gender. They are very often male-oriented, female drug users are underrepresented. Another important knowledge we found out is the regional differences. Many programs are organized at the national level in cities, but the rural areas are underrepresented. So all these kind of findings that we made in the first year will now be translated in the second and the third year into trainings, publications, and advocacy efforts.
So the European Network of People Who Use Drugs and Correlation are key partners, connecting the harm reduction movement with the drug user rights movement. EuroInput has a cross-cutting role across the Busz project, and particularly our job is to gather the voices of people who use drugs, to inform the work of our professional partners, and also to document and demonstrate good practice being undertaken by community-led organisations in the European Union.
We have been talking about foresight research. Foresight research is an innovative way of research which is currently being conducted in the drug field. Foresight research is something that gives researchers, policymakers, civil society a better insight and understanding of trends and developments that might shape the future.
What is the ethos of the Correlation European Harm Reduction Network? And as I see it, it is being informed by evidence. It is being informed by the lived experience of people who use drugs and working with empathy and understanding.
It's great to work with a new team who are all very dedicated and committed. We are looking forward to organize the European Harm Reduction Conference next year in Warsaw in December. There is something about the evaluation survey?
Yeah, after a great movie, a great technical problem. I don't know why this never happened before. The QR code, after some responses, paused. It stopped functioning. So Hannah is going to put another one here for those who haven't responded and still are available to do so. Thank you very much. We will show you in a few minutes.
Yeah.
Thank you.
And we will also share it with you afterwards. But our experience is that people fill it in easier when they're at the meeting. But nevertheless, no other words, no much ado, as Tony would say. Thanks a lot and safe travels home. Ciao. Yeah, we wanted to make a photo, right? So the idea would